Hafide, welcome to the Guam Congress Building. We're now going to, the Committee on Health, Land, Justice, and Culture is now going to hear Bill number 222-37 COR, introduced by myself, Therese M. Terlaje. It's an act to reserve lot number 2417-1-R7, the former Department of Public Health and Social Services main building in MANGILAO, for immediate use by the Department of Public Health and Social Services. Thank you to all who are here. Thank you to my colleagues who are here, including Senator Terlaje, Senator Joanne Brown, Senator Chris Barnett, Sijus Masi colleagues. Public notice was given on December 29th and on January 5th for this public hearing. It's also being live streamed on the legislature's YouTube channel. Before you testify, please state your name, and if you're representing an entity, please state that entity. All right, so we'll begin with Bill number 222. I'm the sponsor, so I'm just going to introduce it briefly. I'm hoping it's self-explanatory. It's really the building in MANGILAO that public health used to operate out of. I'm urging that it be recovered and renewed, and that it begin services immediately. And this is following hearings on northern and southern health centers and the urgency and the critical needs that the people are facing in regards to health care, how we have adopted a community policy of getting this out to the community as a priority for the government of Guam, and the uniqueness of this facility when it was left, that it was actually providing services that were not available in any of the other health centers. And I've been urged by nurses and many others that they feel they can take care of their patients better if they are moved back into their facility. So we heard in the media what happened and everybody moved out, but I'm sure we'll hear in more detail. But it was generally that there was a fire hazard or an electrical problem. They moved out pretty suddenly. It was declared an emergency for the department to move out and find other spaces to rent. They've currently been renting or in other government property since then. And but I would just like to see, and we're going to hear from the Director of Department of Public Works as to the status of the building itself as well. All right. Okay. So just some background, sorry. We have a legal review pending. We have a fiscal impact note that says the bill will have no effect on any government of Guam funds. All right, so now we'll hear from, it's okay if I ask the Department of Public Works to go first. Director?
Thank you very much, Madam Speaker, Madam Chair. Thank you also, members of the committee, other senators. My name is Vince Ariola. I'm the Director of the Department of Public Works. I don't have a written testimony, but I received an invitation from the office to come and talk about this bill, not specifically, but on the side, the status of the current building, the public health building that sits on that piece of property. And so I am here to speak to that. We have as you mentioned, quite a few years ago, there was an electrical fire. Public Works went in there, GFD went in there, and I believe a few other agencies went out there, and the bottom line was we shut the building down and vacated the building because of electrical deficiencies, among other things. And so in the years that have passed, while DPW doesn't use the building, it was used by Public Health, there's a lot of discussion about what do we do about the building. Our position was we basically wait for direction on what to do with the building. And so over the last probably, I hate to say it, but probably about the last 9, if not 10 months, we've been working on getting a complete assessment of the building done to determine whether it's still viable as a working building, bringing it back up to code, or is it something that we perhaps want to raise and then put a new building there for the same purposes, or for any other purposes for that matter. I'm here to report that we have an RFP that'll be going out hopefully in the next, I'd like to say 2, if not 3 weeks, but a lot of that depends again on the approval from the Attorney General's office. We've been working with them on this RFP, and this RFP would be out there to solicit a firm, an engineering architectural firm, to do a complete assessment of the building. And that assessment would include structural issues, mechanical issues, HVAC, plumbing, electrical, of course. And the 2 schools of thought there is, do we keep this building and do we renovate it? Do we rehabilitate it, bring it up to current building code, and use it for offices, public health offices, whatever the case may be. And so hopefully we can get that out. It's on my desk. It's probably at on the technical side with the scope of work, we're probably at about 90%. Engineers have taken their shot at it, so we're in the final stages. Once it clears my desk, it'll go back to the Attorney General's office for final approval, and then we'll get it released. But so again, I think the 2 schools of thought are: do we continue to keep the building, repair it, renovate it, rehabilitate it, or do we raise it and start anew? Part of that RFP will also include advising the government on what the best plans of action are for that building, and to give us also not complete plans and so on and so forth, but to give us an idea of what it's going to cost to say rehabilitate it, or to destroy it, or whatever the case may be. So that's where we stand right now with the building. It's as I understand, it's government land. It's a government building. We're talking a little bit over 70,000 square feet of space for the entire building. And I don't know how many employees it used to house. Probably the director would probably have a better knowledge of that, but I have to imagine probably 400 or something like that. But that's where we stand right now. If all goes well, we can get that RFP out to the public in the next 3-4 weeks. It'll clear my review and my staff's review in the next 10 days, and then we can shoot it over to the Attorney General's office for final release to the public. So that's really where we stand. It's going to be a comprehensive review of the building. It's a large building. It's a lot to review. Like I mentioned, we have to review electrical, mechanical, plumbing issues, air conditioning issues, structural issues, and then what's it going to take to bring it back up to code. So that's what I have for my presentation today, Madam Speaker. Thank you.
Thank you. If you don't mind, colleagues, we'll take questions for the director, and then maybe he will be able to leave, if that's okay. I have a couple questions, I hope. So I guess I thought the RFP was going to go out today. I'm disappointed to hear it's going to take still 2 to 3 weeks, you said. Then you said 3 to 4 weeks. And I'm like, oh, it's just sounding worse and worse. This was actually first announced by Linda DeNorsi in 2019 when the emergency happened, that she was going to get an assessment or have DPW do an assessment. And that's 4 years ago.
I'm sorry, Madam Speaker, I didn't get a work order for anything like that. And the one that got released today is the Simon Sanchez RFP. So that got released today. Yeah. But
I see.
As for a work order to get an assessment done of the building, we hadn't received that.
4 years, when you issue your RFP, how much time is it going to give the architect to give you an answer?
Ooh, I think we're asking for 60, if not 90 days on this one.
Are you asking him to assess it for any particular use, or just to assess generally as you described?
Just generally, as we described, for government office space and government office space and clinic space.
All right. Were any of the emergency funds released pursuant to Executive Order 2019-26 back in November 2019 used for an assessment of the building at that time?
Not to my knowledge.
All right. Has DPW done any other assessments in the 4 years?
There was one done initially, and I think it was between our former chief engineer and the Guam Fire Department. I'm sorry to say I don't have that assessment that was done, but at the time, what I recall, the assessment was done, and they said vacate the building, vacate both entities, plus a few others, plus I believe Public Health said vacate the premises.
All right. Sutusmasi, Director.
Thank you.
Senator Taitagua?
Thank you, Madam Speaker and Madam Chair. Good afternoon, gentlemen. Vince, I remember when this all happened, when it was vacated, the building in MANGILAO, and we were waiting to find out what the next step was going to happen. And I believe in the 35th Guam legislature, several years ago, I sent you a letter requesting if the building has been condemned. Because we were hearing in the media that it's been condemned, there was a fire, and can't be used anymore. So I think you responded to me that you have no documentation of it being condemned.
Right.
And that so the next step I did was I went to the fire department, and I asked the fire department, did you condemn public health building in MANGILAO? And they said no. So here we're getting from the administration that the building has been condemned, we can't use it any longer, we have to take all these departments in public health and put them everywhere else. So that's the extent of my research that I was doing way back. And I really, truly believe that we could have, fixed up public health, put some of those offices back in there. It was so convenient, especially for the people in the South, not having to go all the way to Dedido or going all the way to, Timbuktu to try and get some service or some help. It's just a perfect location. And I'd like to see it stay that way within public health. So has there been any change that you might know of from fire or public works that you changed your mind and the building's condemned?
Senator, I never, that term condemn never crossed my desk. Okay. I don't have anything.
I can pull up some newspaper articles to show you exactly, where the word condemned came from.
Yeah, it could be.
It couldn't come from your office, then, is what you're saying.
Yeah,
okay.
Not from my office that it was condemned. So, and we don't know these things, right, until we get professionals to go in there and do proper assessments, professional assessments, and advise us what the extent of damage is and whether, you weigh it. Do we, like I just mentioned, do we condemn the building and raise it? Do we take it down or no? If you look at the numbers in today's construction costs, it's still worth it to rehabilitate and renovate the building. We don't know those. We don't have those.
Well,
answers
it's obvious.
Right
it was too late. We acted way too late. I mean, nowadays, the cost, like you said, has gone sky high. So when we could have repaired any damages, we could have made a move 4 years ago, we'd be in better shape than we are. And sitting and procrastinating on this is very upsetting, very upsetting. So I'm glad that the Speaker introduced this legislation, which I'd like to be a co-sponsor of, because I have been looking into this. And I'd like to see it to go back to public health as well in every possible way. So that being said, thank you, Vince, and I hope you can continue to get some quotes on how to fix it and what you can do, and to save costs by doing it in-house. If you have, you have engineers. We were just talking about tons of engineers in your office. You have them. You also have some other construction workers within your privy. So I ask that you utilize them, and let's see about getting this place repaired and back up for the people to use. Thank you, Madam Speaker.
Sitos Masi, Senator Taitagui. Senator Brown.
Thank you very much, Madam Speaker. Certainly good afternoon to our Director of Public Works. I just wanted to ask, because I've never been into the building since this fire happened, do we know to what degree this electrical fire, what damage did it physically do to the building? Do we know?
I don't know. I myself didn't go in. I wasn't allowed in. But what I understand, there was an electrical fire, and from what I've heard, the circuits were overloaded. There was extension cords throughout the place. You know, there are a lot of air conditioning units, split air conditioning units. They just kept adding, and I think the electrical system just couldn't handle it anymore. It's my understanding, and there was an electrical fire.
But you don't know to what degree the fire impacted the building? Maybe we could get that information. I mean, I had a building that had a major fire at the Port Authority of Guam, and you know, it did take some time, but we refurbished it, rebuilt it, and moved back in, and we're operational. And so not knowing in this particular case what exactly and to what degree, I mean, is an electrical fire just, you know, did it burn the fuse box or did it burn the building?
My understanding was the complete electrical failure throughout the building. So on the electrical side, the damages were pretty extensive.
But electrical lines can be replaced, yes.
Yes, ma'am.
I mean, versus structural. I mean, if the structure is still sound, I mean, they can rewire the facility and certainly accommodate additional loads to address the need and expansion. But I concur. I mean, I am supportive of this bill. I hope the Speaker will also include me as a co-sponsor, because when I see our former mayor, Nick Francisco from MANGILAO, when I was a resident of MANGILAO, I mean, I went to Price School, and they took us up to public health to get our orientation, to get our dental work. I mean, I've actually been there for dental work. You know, and you go there to get your birth certificates and other things. It was very convenient. So I want to see the operations reconsolidated to make it functional. And if it is, I mean, however it is ultimately, if it's going to cost to refurbish it, or even if the decision's made it's not structurally sound, it has to be rebuilt, I think public health should rebuild on that site and return back to capacity. Because if we continue to lose capacity, then what have our people gained? Nothing. But I'm going to also say the fact that the administration has taken so long to address that facility, to leave it sitting there to deteriorate further, is concerning. Because no immediate action was taken one way or the other to assess the building, determine could it be repaired, and if it could be repaired, to move to do so. I'm sure when the time comes, I will ask the Director of Public Health how much it's costing in rental, to disperse everyone everywhere. And I'm sure from an operational standpoint, I'm sure it's very challenging. But certainly from the people's standpoint, from the public standpoint that elected us, I think we would like to see a functioning public health facility on that property. And I realize there's other interests that have been expressed, but where else is public health going to go? I understand the move and desire for the governor to have a consolidated complex. I don't agree with it. I don't think we need to build all that. I think we need to get a functioning hospital, but I don't see the need to have public health, to be in the same facility. I think public health should be out in the community where it can reach more people and service more people, especially those in our community that don't have other forms of medical support, don't have insurance, and can't get these services anywhere else. So it would be good to know if there are photos or assessments that were done at the time, because it makes no sense to me. I don't understand how the building was just abandoned and left to deteriorate and decay. Whatever equipment you may have had in there, I'm sure after sitting, even after 3 or 4 years, especially if it's left in that state, is not going to be probably functional. It's probably going to cost even more money to replace all that. So that I don't understand. Maybe that's a question I can ask the director, because it makes no sense to me. And like I said, when we had that fire, I guess it was 2015 at the port, where we had customs occupying an office downstairs. I mean, that space was burned to a char. It was black. Everything was black. The entire building had smoke damage. Anything that had a surface had smoke damage. And that building was built in 1968. Public health building was built in the early 70s. So at least it's a few years younger. But again, the action to simply leave it, abandon it, and move elsewhere and let it sit, is disturbing, because these assessments and everything that you're looking at doing now really should have been done then. There should have been a sense to expedite and facilitate so that the services could still be provided to the people. But since you don't know and you don't have information, I can't press you any further on that. But thank you very much for responding to my question. Thank you very much, Madam Speaker.
Thank you very much, Senator Brown. Senator Barnett.
Thank you, Madam Chair. Yeah, I'm not sure how many different ways we can all say we're very disappointed that nothing has been done since the fire in 2019, and I'm eager to hear the director's testimony, and I'm encouraged by the presence of our public health family, and I've just looked at a little bit of the testimony that's coming up, and I'm excited to hear that you guys want to come home to Mangi Town. So thank you for that. So Vince, there's been, like, you haven't, as the director of the department, set foot into the old public health facility in MANGILAO?
I'm sorry, the question?
Have you guys has anybody set foot into the building?
We had, back then, we had our chief engineer, a few other engineers were there with Guam Fire, and they were allowed in. But once, I believe it was determined by Guam Fire, they're not here, but my recollection is it was determined by Guam Fire to vacate the building and to keep people out of there. So we shuttered the building.
And then that was in 2019 that determination was made?
Probably late 2019.
Okay. I guess I'll save my other questions for the director, but who would initiate a request to your department to do like an assessment or to go inside the building and do any kind of like structural examination?
It's basically like Art came to me like early last year, probably the first quarter of last year, 2023, and you know, we talked about, and we met actually about what's it going to take to get the building back up to speed. What was my recommendation? What's the staff recommendation? And you know, I told him, I said, we don't have the capacity internally to do this type of an assessment, to review the electrical, the structural, because what I understand again is there's also some water leaks going throughout the building. There's some HVAC issues. That's why there were a lot of split units throughout. So you know, we sat down and we said, you find the money, and we'll get the RFP out to do a complete assessment of the building, which is exactly what's needed. Building's kind of old, so we need to take a complete look at what's needed to rehabilitate it.
And forgive me for sounding naive, but that's not something like building inspectors or anybody under the DPW umbrella?
No.
Thank you, Madam Chair.
Thank you. So I received from Senator Taitakwi a copy of what looks like a claim that was submitted by then Director Linda DeNorsi to Beneficial Adjusting Company, the insurance company. And I can't tell the total claim because all I can find here is $600 for doors. And then the insurance company's reply was that they have no liability because it's electrical damage, specifically expressly exempted according to their contract. So, but this is how they wrote it out. It was reported that smoke was located in the Vital Statistics Office and the source of origin could not be determined. Department of Public Works was requested to inspect premises to determine source of origin. At the time of the field evaluation, the information was not available from DPW. This is from the insurance company again. There was no soot cover or any fire-related damages observed. Some of the light fixtures and acoustical ceiling tiles were removed by the fire department, exposing the electrical wiring. However, there did not appear to be any apparent electrical malfunction or damage to the wiring. The fire sprinklers were not activated and the power was shut off before any significant heat buildup developed and eventually cleared. The electrical panel boards were also reviewed and it was observed that much of the electrical wiring appeared to be experiencing overheating. According to electrical engineer Mr. Wayne Wixon, PE, it is highly recommended that the wiring circuits be checked for preventative measures, especially with this type of incident occurring. And then it refers to the electrical clause where they're exempt from any damage due to electrical. But the only claim on here is $600 for doors that the fire department broke down. Okay, I'll review that in more detail, but that's my assessment of that so far. Okay, thank you again, Director Ariola. Excuse my seat. I wonder if your RFP will be published, or how can we get notice of when that is sent out?
There will be a public notice once we send it out, but I can update my committee chair as soon as it's about ready to go out for this one, for the
All right,
public.
or could you just send me a copy?
Yes, yes, ma'am.
Thank you.
Thank you.
Okay. And now the Director of Department of Public Health and Social Services.
Thank you, Madam Speaker, Madam Chair, members of the 37th Guam Legislature. I'm Martin Augustine, Director of Public Health and Social Services. In regards to Bill 222-37, what I would like to bring to the floor this afternoon really is a bigger picture. GCC has some ideas and has proven itself to build capacity, to build our workforce. DPHSS has proven itself, the capacity to provide public health and social welfare services. What is not in this legislation is really what I would like us to consider. That is putting a model that embraces and engages GCC and public health and social services to work together, to put forth a partnership, one that maintains the location, yet used by both entities to provide opportunity for training for workforce development, academia perhaps, while also being a practice setting. I believe this is what we should really be talking about. How can we move forward collaboratively? Although we are here for 222-37, there's 221-37, and that's not what we're here for today, I understand. But that is another piece of legislation that, when heard, will possibly impact the direction and outcome of the property of interest. So I'm asking Madam Speaker, Madam Chair, and members of the 37th Guam Legislature, let us not work in silos. Let us work collaboratively together. We just completed a Health and Social Services Workforce Development Collaborative Summit. In that, we are reminded of how much more we can accomplish for Guam and for the region. Really emphasis on Guam at this point today when we work together. If it is just for training, where will they practice? If it's just for services, where can they get training? As the Director of Public Health and Social Services, how can I discount an effort to build workforce capacity? A workforce that will someday perhaps be working in public health and social services, or the contracts that we provide, like childcare industry. So in speaking with President Okada, we're both amenable to putting us to work together. Let us work through this. Let us design and put the concepts together for GCC and public health and social services. And let's see what happens with the assessment of the structure. For all we know, DPW may recommend a total demolition of the MANGILAO facility. If that is the recommended course, then that gives us a blank slate to start with. This is where President Okada and I could sit at the table and put the concepts and design together. We share a common interest to include a model childcare center and perhaps childcare services that can support the students that want to attend GCC or UOG. Perhaps other training opportunities from other private entities can be engaged to come to the training site to build on our workforce development efforts. And as I say that, we are still going to be providing public health and social welfare services at the central public health facility, like immunization, vital records, or applications for public welfare programs. So we are not going to discontinue our service. Instead, we will become a training and service location. For me, that's what we really need. It's not just about who owns the property. Now, when President Okada goes out to apply for grants, or however she funds the GCC projects, she may be required to show ownership. So perhaps those are points of interest that we could discuss in a collaborative spirit so we all benefit. As for public health and social services, the question is, how are we going to fund the CPHF, which is a central public health facility? We pay rent today. Those rental dollars can be redirected for us to sustain and maintain the structure, both interior and exterior, grounds maintenance, security, interior cleaning, AC maintenance, and so forth. This would be a structure that has preventive maintenance. So in this situation, those offices that generate funds in program income or a grant will include in their grant application, their office usage requires that they maintain the structure. I really don't know which grant would ever discount that. So I offer this, Madam Speaker. I ask that you reconsider this property discussion today, and let's put legislation together or engage a roundtable of key stakeholders to identify, after the assessment of the structure, what the best use of the property would be. Thank you very much.
Thank you, Director. Is there anyone else who wants to testify in their official capacity in the department? All right, then let me just ask you a couple of questions.
Absolutely.
One is, the building lay dormant for 4 years, and at the time it looks like, you know, the director tried to get insurance coverage. It was denied, but a pretty clear assessment of the damage, the minimal damage, it sounds like. And yet, this has not been pursued since you've been the director, and that's been how long now?
Well, Madam Speaker, yes. So when I started in July 2020, the primary focus of Public Health and Social Services, and up through May 2023, which is just part of last year, was the response to COVID. The public health emergency had expired in May of 2023. And so from the time I started, there really was the emphasis placed on our COVID response. We did testing and vaccination, and that consumed many, if not all, parts of public health and social services. So in 2023, I transmitted a letter after discussing what the options are with Director Arriola to formally request his assistance to evaluate the structure. The request is really asking, do we retrofit the structure? Is it usable? Can we build up? Can we build across? And so we're looking at the options there. And as I referenced in the collaborative summit, really it's us working together. We
Right.
know that there's a shortage of workforce on Guam.
Yes.
So wouldn't it be great if we could train and then have those very individuals perhaps do internship or, you know, not residency perhaps, but actually have practice settings in public health and social service, like in immunization or family health and planning or family health and nursing services.
I'm sure there are many potential uses of a facility like that, and workforce development, I think that's an entire government priority, and so I'm not denying any of that. What I'm asking is, do you believe that there's an urgency to reopen particularly the clinic part of that facility, where the nurses operated and were able to treat patients, where the doctors were able to treat patients, where they're currently not?
Well,
Do you believe that's urgent? That you believe that there's been any decrease in services because of the closure of that building?
I would say that there is the opportunity for many other programs to, and I've already recently had conversations with their division heads, to look at doing rental space so they can fully operate. There may have been some decreases, but some of the decreases, Madam Speaker, members, is a result of COVID-19. Many of our nurses were redirected, so their numbers anticipatedly would be low. It's pretty similar to when we had conversations in the past where we started seeing a spike of individuals coming in because they had delayed going out for medical checkups because the directive at the time, the guidance at the time, was to stay at home as much as possible. So,
All
folks,
right, I don't want to confuse this issue with a discussion of COVID. We all understand that circumstances were different during COVID, and if maybe you were open at the time, you might have operated differently out of there, but still. Didn't you have a dental clinic in that building?
Because at this time, ma'am, we are working with an individual that we are hoping to bring on board to revitalize the dental program.
Hoping to bring on board 4 years later. This is my point.
Right.
That for 4 years, and I've had discussions with you, so even during COVID, I believe, you know, what's the status of the building? Why aren't you pursuing the building? The nurses want to move back into the building. What are you doing about it? And yeah, so I'm glad that you finally wrote a letter to DPW to inspect the building after 4 years. Do you think that there's some damage to the building for not even looking inside it for 4 years, for not maintaining it for 4 years?
Well, you know, I can't say, ma'am, how the building has deteriorated. If it has, that's not my area of expertise, ma'am. I imagine that that's what a lot of people have said, that when you let a building sit. However, we are using it to some extent at one point to store our supplies and materials that we can store appropriately in that facility at one time. But we also
Who goes in there to do the storage?
At one time, it was our, I believe it was our FEP grant, our Public Health Emergency Preparedness, our folks that were helping us with COVID response. Yeah, so it was very limited, though.
All right. It's just, I guess maybe we just have a difference of opinion as to what's urgent, services that need to be provided, and I respect that you're now going to contract with people to provide services that have been delayed for 4 years, or contract with them to provide a space for additional services that has been held back for 4 years, and 2 years of that might have been COVID, yes, but still. Can you just clarify again? I asked you, when did you become the director?
July 2020.
July 2020.
Well, I'll confirm in October, ma'am.
Pardon?
Confirmed in October.
Confirmed in October, okay.
Of
Thank you.
2020.
All right. So did you ask for the assessment to assess the building for use by Department of Public Health and Social Services? Or did you ask, you've done a great job advocating for GCC, or did you ask for an assessment for the building's use for GCC?
No, the assessment was for Public Health and Social Services, ma'am.
Okay.
There was a formal request made to current Director Ariola.
All right. And I expect that no matter what happens with this bill or the other bill has a funding source, so it had to be referred for funding confirmation first, and then it will be referred to my committee. And I have no objection to increasing workforce, and I have no objection to partnering. I expect that, actually. I don't expect that we need to pass a bill to get those things done. We just broke ground on UOG building a whole new health center just last month. So we have a lot of work to do in many areas, but yeah, so my concern with this bill is just pretty much critical services, the urgent need for them, the delay, and the impact on our community because of that.
If I may, Speaker, with regards to services and focusing on our clinic services is definitely of interest and importance. However, in terms of the entire structure, again, I would have to defer to the experts if the structure in any form can be actually partially used. Because of the current system, I don't know that we could, unless we retrofit the entire facility, which then would allow for more than just clinical services, of nursing services and physician services. We would give that opportunity. And yes, I thank you for recognizing the need for partnership because of the shortage of healthcare practitioners. Thank you.
Yes, yes. And social workers?
And social workers, they're part of that.
CPS crisis continues, as far as I'm concerned. There's many areas where we need concern. So, all right, thank you. Senator Taitukwi.
Madam Chair. Good afternoon, Art.
Good afternoon, ma'am.
Yeah, I do understand the situation that you were in after the fire, when you came on board, but it was, when I reached out to you, giving enough time after COVID, stuff, really anxious to get things rolling and bringing up the Manila facility back to where it was, or even improved, for that matter. I sent you an email, a letter, on November 15, 2021. I received a response with my email was regarding the status of public health and social services. That was 2021 of November. I received a response from you on December 15th, a month later, 2021. And that's the documents that I shared with the speaker that you sent me, actually, on the beneficiary. But what I'm so disappointed in is that, between the speaker and myself, going back and forth and asking you what the status is on the facility. And then we come into a situation where, we're talking about a new hospital and how the South, it would be so great to have a hospital in MANGILAO area because, it helps those from the South of 5 more minutes of time, to get to a place that would provide them health care or, an emergency situation. I don't think we would be talking about a hospital in MANGILAO if we had public health up and running right now in MANGILAO and address those concerns and move forward on somewhere that's more affordable. And speaking of affordable, we all know that it's under your purview. Public health is under, that building is under your jurisdiction, your house, compared to what you're spending in millions of dollars of rental somewhere else. That's not very financially responsible with the people's money to do that. And you know, I sound frustrated because I am, and because I've been trying to get a hold of public health to address this facility since 2021, November. And you know, nothing has really been done. Did you answer the question if anybody in the facility or anybody in your agency had an opportunity to go in to see an assessment? Because let me tell you what your letter stated, that you responded to me with. In your letter, you are requesting for a copy of assessment conducted by Department of Public Works. I have requested a copy of assessments from DPW, and I would provide it to you once received, which I haven't received, by the way. The MANGILAO facility is currently vacant. However, staff has been assessing the contents inside the building in an effort to determine what items may be salvageable. Once the assessment is completed, our department will work closely with other agencies to determine what would be in the best use for the building. If you should have any questions, feel free to contact Bertha Tyron, Program Coordinator. What is the status of that report, that assessment?
Well, the employees, we don't have anyone who will do physical structure assessments, but in terms of the division heads were all asked to go in and do a survey of those divisions and programs that were in the Central Public Health Facility to remove any equipment, furniture that is salvageable, including client files or any administrative items that could be removed, in the anticipation that perhaps we would have to retrofit, and if an external company were to come in, we need to be sure that there's no records and files sitting in a drawer or on a shelf or on a counter anywhere within public health and social services facilities. So the last input I received or feedback from the division heads is they've completed that.
Do you have a report?
I don't think we have. I'd have to check if Bert received any written report. Yeah, Bert has been our facilities person.
Once an assessment is completed, our department will work closely with other agencies to determine what is in the best use of the building, was what you said prior to that. But you said staff has been assessing the contents inside the building.
Yeah, that is correct.
Okay. So you don't have a report?
I have to check with Bert, Senator, and then I can let you know.
Well, I'd appreciate if you can provide it to the committee chair, and which she'll share with us as well as members of the committee to see that report. Curious to see how much, you know, because as I said earlier, or mentioned, that I provided the adjustment from the insurance company. And really, it's quite shocking just to see that there was smoke in vital statistics, room area, contact point, and only $600 for damages, and that was to doors. So I'm just curious to see if we lost a lot of equipment or things that have to be replaced, and if not, I just don't understand then why you had to move out. If you only had damage of $600 to doors, and then we can't get an assessment of what was really damaged in there, is telling on really the condition of the building. And there was really no reason why, unless there was a shenanigans going on to rent from someone's best friend for public health and make millions of dollars a year. We need some answers. Why was that building left dormant for this long of a period? And as far as like sharing, with GCC, I know Mary's here, and would like to have some of that property too. They have a great campus. She's done great things at GCC, huge, but they're not out renting facilities from other people for their campus. Not like what public health is doing right now and spending millions of dollars that can actually go to the community to really help them. So Art, this letter was given to you in good faith and to give you that opportunity, and you dropped the ball.
I don't believe I dropped the ball, man. We were responding to COVID-19, and this is one of the concerns.
2021.
Yes,
Art.
exactly. We didn't expire until
December.
public health emergency expired
December
in May
of 2021.
Absolutely, Senator. And this is one of the concerns, Madam Speaker, that many health practitioners are concerned with. When the thrust of COVID-19, we're in the mix of COVID-19, we're in the trenches. Now that things have settled, it's like you haven't done this, you haven't done. There's a lot of, I will say, there is a lot of administrative work ahead for public health and social services. And one of them, which was able to get to this year, is working on where public health facility will be. Thus, the assessment that we've asked Public Works, the Director of Public Works, to look into and to help us look at that facility, right? We don't know what the assessment's going to be. There's a legislation here before us that says to reserve a structure, this building, at least unless someone else can offer a different position, this is still a public health and social services structure. So legislation is saying to reserve it is doing what? It's repeating what's already there. So do I notarize
It's
a
to
title
prevent,
of a
Mr.
vehicle
Director.
where you already have title of ownership? I mean, come on.
That's correct. You're the owner, yet that you're advocating that it be
It'd be
used by
shared.
somebody else. So
No,
this
no.
is to prevent
I am-
that. That's
I am
what it
asking
is.
that if
So
we can build up,
Thank you.
if we can build up, Madam Speaker,
Then
we can build
good.
capacity.
I
right?
agree. Let's
I mean,
build it.
And we got someone who can train our staff at some levels, and we can build that relationship. I mean,
You know,
that's,
Art, if I may, Art,
ma'am.
I know your agency has so many different variables in it, you know, and you address a lot of it from senior citizens to,
Absolutely.
social workers. I mean, your agency, of all the agencies on the government of Guam, is probably the most difficult. And I have to tell you, and my hat is off to all your employees that are working very tirelessly, even on their own personal time, to try and address this. They've done a great job, an excellent job. But they need a leader that's going to actually do things that would help save money for them, would not put them in harm's way, to provide the best working environment you can for your employees. So, you know, there's just a lot going on here, and we have to stop using COVID as an excuse. We have to learn to live with COVID. Even at the very beginning of COVID, one of the comments that were made, I think Chuma was here. Yeah, Chuma was here. That moving forward, this was 2020. We have to learn to live with this pandemic, not let it live us. So let's stop, you know, blaming it on COVID, even though there, you know, I know what you're, there is some issues with that, but that happened in 2020. We are now 2024. So it's time that public health get their building back.
and Madam
You know,
Senator,
let's do it. Let's do it, Art.
That's the basis
Like
of the letter.
within the next 3 months,
As
let's
you
do
say,
it.
to make sure the facility is safe, we need to get it assessed.
And I'm
So that
giving
the
you 3
employees-
months.
I can't say 3 months. I'm not the one directing the assessment, or I'm not the architectural firm to do that. That is
All right.
beyond my control.
Thank you.
Well, okay. Well, I'm just trying to put a timeline here. I like
Right,
timelines.
But it may not. It may
If
be an
they're not met,
artificial
then
timeline. I
whose
can't
fault is it?
say.
Okay, let's put hope in there. 3 months. Thank you, Madam.
Thank you,
Speaker.
Senator. Senator Brown.
Thank you very much, Madam Speaker. Certainly, Director San Augustine, I think you're getting a sense for those of us that are here, you know, our disappointment with regards to the fact that more immediate action was not taken. Because, I mean, again, I don't know the degree of what happened. If it's simply smoke, I don't know if the structure was burned. You know, like I said, I'm sure it's a different structure to that building than my own experience. But, you know, we moved very quickly. We had to move everyone out of our building at the port. But we expedited facilitating getting everybody back in and getting the building, you know, the areas that had to be rebuilt and torn out were done. And, you know, every surface that had a surface had to be cleaned, sanitized, the air conditioning vent system. I mean, it was quite an undertaking, but we were able to get everybody back in and get the building operational and move on. And, you know, these services, as a result, and you know better than I would, you know, to what degree it impacted your ability to service the community. You know, my position is I would love to see that land continue to remain in the hands of public health, and whatever the ultimate outcome is if it's, if it can be renovated and corrected, then by all means, let's get back and get operational because we want to see those services provided. I understand the politics of it. Let's not sidestep the reality here. I think the whole intention was slowed down primarily so that the governor's position on wanting to consolidate all these operations in a single complex, it fills that argument. At least that's how I see it. That's why I believe it was not prioritized. But to simply leave a building to sit that is under your care, that to me is unimaginable. And I've sat in your seat, not at public health, but I've sat at other agencies. And that would have been unimaginable to simply leave the building there and not determine whether or not electrical, like I said, rewiring could be done to the facility to accommodate it. If it's still structurally sound, then maybe we do need to renovate it to facilitate to get those services because you've lost capacity. And I wanted to ask, how much money are you using now to spend in rental to accommodate, your staff and your services that you used to provide at the MANGILAO facility? What annual cost to your rental now, having to rent property from a facility was not being rented before? And where did your people go? Where are they dispersed that used to be consolidated at the MANGILAO facility?
To your question, Senator, we do have several of our offices throughout the island. I did share this with the body at other meetings. We have, with contracted services, we have about 17 different locations. I do want to share with the body this afternoon, there was an attempt by Public Health and Social Services to consolidate all of us into a general vicinity, general building structure, or multiple structures that are nearby. We did that, I think we did it in 2022, but that procurement did not come through. More recently, I've talked to division heads to go ahead and proceed on with, until the structure is assessed, to go ahead and get engaged into having their entire divisions brought together and work out of a central area so that, for example, Division of Public Health, Division of Public Welfare would have one general area for all of its healthcare financing, its BES, its Economic Security Management Support Offices. With the Division of Public Health, there's always going to be 2 community health centers, and Central was our central public health facility. So it's a little different there. And so that's something that I've talked to a few division heads already about. So our total rent so far, in terms of the offices, including those, this unfortunately includes everybody. We're spending $2.4 million a year in rent, but that I had asked for the. This one includes. We're going to take about $200,000 out for DSC because they're already renting, and maybe a little, give or take. We're looking at SNAP 200, 400. 7, 8, about $1 million, a little over $1 million has been now an additional expense that we are using for rent. I'm looking at the text there. This doesn't have the breakdown by those that were already renters and those that we added on because of the relocation. But we did relocate, Senator, the SNAP program, the part of the Medicaid program, General Admin, which is down at Hessler. Environmental Health is now at Hessler. ELC is over at RandCare. The Guam Public Health Lab is also at RandCare. Vital Stats is at RandCare. BNCD has already been existing prior to COVID. Bureau of Child Care was there, BOSA was there, and PDG, about 100,000 is available for rent. So over $1 million, I would estimate, not having it broken down here, but I can provide that to the chair and share that with you.
I think we would appreciate that, so we actually will know how much has been expended. Sure. And is this out of your, and how are you funding it, through your budget, or do you have federal funds that are funding it?
Yes, it's a combination, Senator. Some are federally funded, and some are through program income, perhaps, and some are through generation of funds, revenue generating accounts.
Since you were director at the time, what actual damage happened to the building? Because, I mean, reading the report, it said there was smoke, but what actual physical damage happened to the building?
When I got in 2020, COVID was our primary focus, and so when we got around to looking at the building and to the question the Senator referenced, it really is as reported. It's a door that was broken down. It lacked preventive maintenance. The staff who are here will all attest. We have, when a rainy day, we have leak into the facility. We've had that roof repaired multiple times, multiple occasions. Because our AC is not always 100% reliant, even though we did a hardening project for it, or generator, we had offices that would install split AC units. The electrical panel, I suspect, because I wasn't managing the department at the time, was not being upgraded as you add on more electrical demands to the system. So as the report indicated, the panel was overheating, and it could have been addressed through preventive maintenance. There was a decision made to vacate the facility. That was in 2019. And
Who made that decision? Do you recall? I know you weren't director at the time, but who made the decision to vacate?
I really can't say, Senator. In 2019, the Division of Senior Citizens has never been a tenant or housed in the main facility, Central Public Health. We refer to it as Central. We've always been outside of that facility, right? So I can't say, and I would be guessing. And
Was there any physical damage to the building? Was anything burned? Is my point.
Yeah, not when I walked through it. So they said that it was unsafe. That we needed to get.
Who said it was unsafe?
The reports that I got from the staff, and they showed me, it's like, we have to get this evaluated. So, and if we were going to move in, we need to address the electrical situation. We can't just move back in and recharge up the facility. It may put everybody at risk. And so I know that the Senator Tidegui is saying it's you could talk about COVID, but in 2020 and 2021 to 2020, we were dealing with multiple waves of COVID-19.
No, I understand,
So
but that's where you have your administrative capacity. I think you have more direct deputies than anybody else does in GovGuam. I had 2. How many do you have?
I currently have 2.
Okay, well, you have 2 too. That's good. But I understand COVID. I understand that. That was a really pressing issue, but at the same time, administratively, I mean, unless you're out there testing, you address those issues. You don't let it sit. I can't imagine having left the Port Authority building sit for 3 or 4 years. And there's always other pressing issues you need to address. But again, yes. I think the fact that it sat for that long, and if you're telling me nothing was physically burned, I mean, I dealt with charred walls. Fortunately, the personnel records weren't burned because everything beyond that and the wall that it was connected to all went down in flames. And we were able to rebuild that within a very reasonable period of time, minus we didn't have COVID. But my point is to let the building sit there, as major as an issue as that is, your house for your operations, it is concerning. I mean, you're not the director at the time, but nevertheless, you've taken the helm. And for this to sit this long, it is disturbing. I drive by, the only thing I saw added were the big boulder rocks, I guess, to keep people from driving into the facility. But
right.
I think you get a sense of our concern.
Yes, we do.
For the building to sit there and deteriorate further, especially if there was no physical actual burn to any of the infrastructure within the building. But with that, I appreciate your response to my questions. Thank you very much, Madam Speaker.
Thank you.
Thank you, Senator Brown. And relative to your question, the executive order issued in November 2019 is EO 2019-26 says, as a result of the assessment conducted by GFD, it has been determined that the MANGILAO main facility in its current state cannot adequately function as a DPHSS facility and that all services must be relocated to alternative sites immediately. So, and it says GFD responded to a request for an assessment because of reports of suspicious odor. All right, that's November 2019. Thank you. All right, Senator Barnett.
Thank you, Madam Chair. A day. Yeah, I think the most frustrating thing for me is that, while we talk about how the building is sat for 4 years, and we talk about the cost of public health now occupying 17 different locations, spending, what is it, $1 million? Is it $1 million in rent? $1 million in rent?
It's a conservative estimate, Senator. I will have that numbers put together, and then we'll send it to the chair.
Okay, so $1 million or more in rent. I think the real cost is being paid by the people of Guam. I sat in a hearing on the community health centers a few weeks ago, and they talked about the intent of these community health centers, which were to serve our poor, our vulnerable, and that's why we had one in the south, the central, and the north. And so when we talk about the real cost, I don't think the real cost is the rent and scattering of public health to various points all over the island. The real cost has come to the people of Guam, the lack of services. That I get it, COVID. I know you guys that was your primary responsibility, but a lot of things occurred during COVID that we weren't able to address, and now's the time to pay the piper, right?
Right.
And it is unfortunate that our leaders who came before us saw these needs and anticipated these needs in our community by establishing these community health centers, and again in the north, the central, and the south. And I just cry for our people because, I mean, looking at some of the testimony, we provided so many great services at MANGILAO, and based on what I'm hearing from you today, we're only now, in some ways, trying to reinstate some of those services like the dental and all those things. So I think that's the real cost, and I'm all for workforce development and all that. I love Mary, I love GCC, but I think for me, we took away a huge part of our ability to address the healthcare needs of our people, and I'm not satisfied that we've replaced it with anything meaningful. And I shudder to think that this starving of our people's healthcare system, from the Central Clinic in MANGILAO to the Guam Memorial Hospital, I worry to think that it's in any way intentional to make the building of a medical complex that much more desirable. And I just hope that's not what it is. I really do, because I mean, I'm going to bring up the infant mortality rate and you know, all of the illnesses that our people struggle with. I'm sure you know, Mr. Director, you have an obligation to meet those needs. So nothing further. I really want to get to hear the testimony from the employees, and I hope that they're able to keep to their testimony. I know what it's like with the politics where you have a director saying one thing that you might not agree with, so I'm eager to hear from these employees, ma'am. Thank you, Art. Thank you, Madam Chair.
Thank you, Senator.
Yeah.
I'd also like to recognize the presence of Senator Frank Blas, Minority Leader. Thank you, Senator, for being present. Did you have questions for the Director? All right, so we're going to proceed with the testimony. Situs Masi, Director.
Actually,
you
Madam
can.
Speaker, if
Pardon?
I could, I'd just like to point clarification, please, for the body this afternoon. We have 2 community health centers funded by HRSA. The central facility is not one of the 2 federally qualified health centers. I've met
That's
this
correct.
statement before, and I think there's just a bit of confusion on that. The southern and the region, and southern and the north are community health centers. They're FQHCs funded by HRSA and primarily funded by program income. In terms of the central facility, it is a central public health facility. It doesn't fall under HRSA jurisdiction. So it's not one that is overseen by the Community Health Center Board, the governing board, the advisory board, so that's distinct and separate. I want to assure the body there's no part of my leadership or the deputies or any of the division heads that would have ever done anything intentional to delay the delivery of services. I have never ever sensed that from anyone and throughout the department. I just want to put that on record, so
Right.
thank you
Director,
very much.
can you clarify then that this facility was built prior to the Northern or Southern Health Center being built?
I believe, I don't have the dates of when the north and south were built, but I can get that. But I believe the facility was built, was it in 73?
Was it built, which was built first is my question.
Right, I don't
MANGILAO,
have
right?
But it's not the...
And is it correct that the Southern Health Center and the Northern Health Center do not have all of the services that even under HRSA they're supposed to have, but some of those services were being provided, even though not under HRSA, at the MANGILAO facility?
Right, well, they have different roles, Madam
That's
Speaker.
correct, right?
So north and south
Right,
are
so
your
that's-
primary
is that
care
correct?
service. They're primary care providers, and Central was our central public health facility.
No, there's a whole list of things that they're supposed to provide,
Right.
right? Including dental services, I believe, mental health services, labs, pharmacy, many things not necessarily continuously or regularly provided, and they testified as to the improvements that they are making.
Right.
But Central, MANGILAO, that was a benefit for Guam, that despite HRSA not being the one to mandate it, that we were doing that in MANGILAO.
There were other grants
That's
that funded
where
those
our
activities.
concern stems.
Yeah. Well,
Thank you.
there are other grants, ma'am, Speaker, that
Yes, of
funded those
course.
activities.
Thank you.
Yeah, I just
And
wanted
the
to
lab
clarify.
that you had there. Thank you. Thank you,
you.
Director.
All right.
Okay, so we're going to hear Mr. Francisco, former mayor. also the military of the Purple Heart and VVA commander. If I could ask Linda Raphael, Margarita Gay, Annette Uggan. If there's space, Dr. Weir. And okay, so Mr. Francisco, thank you for your patience and please proceed. Thank you for being here.
Thank you, Madam Speaker, Senator Blas, Senator Brown, Senator Tello, and Burnett. I'm happy to be here today representing the veterans of Guam. I'm here to testify in support of Bill 222-37. Again, my name is Nick Francisco. I'm the former longtime mayor of MANGILAO before public health was built. And I am the commander for the Military Order of the Purple Heart, and I am the president for the Vietnam Veteran of America. These are the other veteran organizations that I'm supporting as testifying for them also for today. The 3rd Marine, the Guam Air Force Association, the American Legion, the Barrigada Veteran Organization, the Dedido Veteran Organization, the Fleet Reserve, the Korean War Veteran, the HOPH, the Military of the Purple Heart, the Vietnam Veteran of America, God U-671, Veteran of Foreign War Post-1509, Veteran of Foreign War Post-2917, and the HMI. So I meet with these commanders and president every quarter. We've been discussing this long time ago because the old legislature with the president governor promised the veteran long time and finally got it for the Veteran Community Center. What delaying us is public health to move out. And for the longest time, Tim Agon, the director for the Veterans Affairs Office, every time we meet with the commanders and president, we ask for an update when public health is moving out. Always the same answer, no definite time. So I'm here today to testify in support of this bill, and thank you, for, Madam Speaker, for introducing this bill. Maybe this once and for all will get public health out of that building and give it to the veteran, because when the veteran called to serve their time, we don't wait. We have to, when they say we're going to Vietnam, we cannot say we're going to wait. So it's sad to tell the veteran that we're waiting over 2 years for public health to move up from the old legislature building, with Governor Lu. Governor Lu already announced, make the announcement way back that this is the home for the Veteran Community Center. So I'm so glad that something is being happened, because the way I hear the director, like they do not plan to move out. So Madam Speaker and all you good senators, I'm here supporting that bill, and I hope that all of you will be supporting the bill. Thank you.
Thank you, Mr. Francisco. Thank you. You're talking about the Hessler building, the old legislature.
That's correct.
That's correct. Thank you. Senator Taitigui, Senator Brown, Senator Blas, Senator Barnett. Si Diyos Masi, here we hear you loud and clear. Thank you to all the veterans who came with you as well today. Okay, so I have signed up in the order they signed up, Linda Raphael and then Margarita Gay. Linda?
Hi, I'm Linda Raphael, and I work as a medical clerk. I just transferred there. It's already going to be 2 years. God rest his soul. Pete Ogden was the one that's been there, and he said that we're not going to get the building back. So I'm just here to say that on behalf of him, I would like to say that we need the building back. We need to serve the people from the Central. I just got a call like last week and said they're coming from down south, and they said, wow, if I have to go all the way down to Dedido to get the service I need. And I said, well, for now, that's all we can do. I mean, there's nothing on my behalf I can do. But I said, but if you feel like you have any other questions, I'm here to help you. You know, our records are like scattered, because since they took us and put us in a small, tiny area in Dedido, it's like, okay, we're looking for a chart, we have to go check in one room, and if it's not in that room, we have to go to the other room, and we have to move boxes and boxes, because remember, public health was built for a long time. So you have records all the way to the 80s. So just to let you know, I wasn't there when it was built, or even there when it was still operable. I just got transferred recently, and I'm just so glad to be there.
Thank you very much, Ms. Sorry. My apologies. Thank you very much, Ms. Raphael. You're currently still employed at Department of Public Health and Social Services in the Records Division Department?
Yes.
Thank you. All right, Margarita Gay.
Good afternoon, Senators, and thank you for the opportunity for having myself here to support the bill of 222-37. I have a PowerPoint and a written testimony.
All right, the PowerPoint should be ready, so please proceed.
I have copies, or they have, you have copies? Oh,
Make copies for all the senators, and
Okay.
it should be loaded. There it is.
Okay. So my name is Margarita Bautista Gay. I am an RN, and I am currently the administrator for the Bureau of Family Health and Nursing Services at the
Sorry, I'm
department.
sorry, Ms. Gay, I don't want to miss your testimony. Can you just speak very close to that microphone? Thank you.
Okay, sorry. Okay. Oh, I'm sorry. Oh, okay. Sorry. Okay.
If you don't mind, can you just start again? Thank you.
Okay. Good afternoon, honorable senators, and to Honorable Therese Terlaje for this bill that you have written. Thank you for the most needed opportunity to provide testimony for Bill 2237 on why we Department of Public Health and Social Service employees need to return to their former place of employment at Central Regional Health Center facilities in MANGILAO. Again, my name is Margarita Bautista Gay, and Administrator for the Bureau of Family Health and Nursing Services. Just by the opening statement, you can see that I have been here at the Department of Public Health and at the Bureau of Family Health and Nursing Services for almost 20 years. One of the department's oldest staff, and I have invested most of my nursing career as the administrator of the Bureau of Family Health and Nursing Services. I come here before you to share my data, experience, and challenges and support to the Department of Public Health and Social Service MANGILAO facility, return to their original occupants. Central Regional Health Center has been the start of my career, starting as a community health nurse, moving up to a supervisor, and then being promoted as an administrator for the Community Health and Nursing Services. I am proud to work at the Department of Public Health and led the public health nurses for 19 years. I've seen this bureau at the total capacity of 40 nurses working at Central Public Health, providing nursing services in all 3 public health services centers. The MANGILAO Center has been the main office of the program managers, healthcare staff, and other public health programs. Most of all, it was centralized location to our clients, our community on Guam. It was like a one-stop center for public health services. The people came to public health for the most needed services, such as birth certificates, health certificates, women and infant children WIC programs, applications for public assistance, free preventive health screenings like HIV, STD testing, payment for health professional licenses, infection diseases, treatments for tuberculosis, Hansen, and STDs. At the Central Regional Health Center facility in MANGILAO, the patients can access the lab, the x-ray, the pharmacy, the dental services. As for the Bureau, the patients can avail of free pregnancy testing, be eligible for early prenatal care, free counseling on family planning methods, free hearing testing, home visiting services, and most common service is free child immunization clinics. The clients all over Guam, knew where the programs were located, their hours of operation, and fees of their services, and majority knew the most of the services these programs provide. Since the so-called electrical fire at Central, the staff and programs were forced to move out of Central in 3 weeks and were displaced, relocated, separated from all other public health programs. Public health also managed the 2 to 3 years of COVID-19 pandemic response. If you ask anyone on Guam, where are the public health programs located? Not all of them will know where exactly all the public health programs and services are located. We continue to hear people going to MANGILAO building, but not knowing that we are no longer there because the building is still standing and no visual damage is noted. Empty building with no one working. They're abandoning for no reason. The relocation and displacement of our Bureau has impacted significant decrease in services. In my testimony, I have the data present, but for the PowerPoint, I will continue on.
Would you like us to turn on the PowerPoint?
Yes,
Okay, please.
Yes.
Turn.
Okay, like the front says, why are we here today? We are here today to support this bill to consider us to moving back to our MANGILAO facility. Next. There were no plans. We were relocated, but there was no plans for Central Regional Public Health relocation and no decisions. We were there. Annette and I were present that day because we were called in. There was a storm coming in, and we were called in to get our vaccines out of the building. The director at the time was Linda DeNorsi. We saw it. We saw it all. We saw the fire engines. We saw the water all over the place. But we immediately reported to our area, but no signs of smoke or smell of smoke in our area. No damages were there, but all we were told was there was an electrical fire. As you can see, my staff, that's our medical records unit. That's one of our pictures that we were moving in the dark. Our files, our supplies, everything that we needed to do implement our service, we had to move out. Next slide. Why do we want to go back? It is a location in the central part of Guam. It's accessible to the people of Guam. People knew where public health was. No major damage to the structure to cause us to not come back to Central. Our clients are lost because they don't know where we went and they don't know what services we offer. I'm saying it for the Bureau of Family Health and Nursing Services because we were housed there. And so it's been 4 years, and all our programs that we had located at Central Public Health in 2019 are all still displaced and need a permanent building to work in. The current state condition, next. Okay. I have there a then and a now. A then is our Central Public Health in MANGILAO, and now the Bureau is located in room 30 in the Dedido Northern Community Health Centers. If you ever seen the Dedido Center, it's hard to find us, but we're there. We have signs, and we are there. Then, when we were in public health, we had over 4,500 square feet housed in that building. Our central nursing offices and clinic is in one building. We were all in MANGILAO. Now, in Dedido, we have less than 1,250 square feet. The Bureau's offices and clinic are in 2 different buildings. We are in Dedido in Northern Health Center, and then I have 4 employees located at the Hessler building in Hagåtña. Again, then, we had adequate space with 1 administrative office for all the programs and a clinic with an x-ray room and over 4,500 square feet. All staff were in one building in MANGILAO with still our home visiting office in Dedido as a satellite site. Our clinic was complete with 6 examination rooms, immunization room, a waiting room, and a medical records. Now we have 3 10 by 10 square feet offices to fit the administrator and 4 program staff. We are located in 2 different buildings, again, like I said, Dedido, and our program staff are also located in Hagåtña. Our clinic consists of only 1 examination room, which 2 providers share, medical records, that is 20 by 20 square feet room, and sharing a waiting area and immunization area with the other clinic service at Northern. We can fit 14 staff in one 20 by 60 square feet as of now in Dedido. And so I mentioned about data, next slide. So I put the 3 women's health, child health, which are women deal with pregnancy, child health dealing with children, and immunization dealing with children and senior citizens, and then total encounters. With the dark blue, it's 2018's data, and then in the light greenish, it's 2021's data. Just by looking at the bars, it's already, we were providing services, but location didn't make a difference in our services. So, next slide. In the women's health, we deal with pregnant moms and adolescents. And in 2018, we saw 1,751. In 2023, we saw 947. Pregnancy doesn't stop in Guam. It's continuing. It stays pretty stable. So my nurse practitioner from the since we relocated, she was trying to make sure that she's there for any of her clients that come in during we had COVID, and when we were allowed to go back to the clinic, she was there. And the staff were there to accept any clients that were able to see us. Pregnancy testing, there's a typo, it's 300, and then in 2023, it was 3,300 clients. Our pregnancy testing is free. Once you get your result, if you're eligible for our program, they will continue with us. If they don't, they will be referred to other doctors in the island. We do not leave our clients astray. We get them to where they are needed. Next slide. We're looking at the immunization. I'm only counting the clients that we immunize. So in 2018, we were able to see 3,652 children and some senior citizens. And then in 2023, we went down to 1,320. And then the next bar is the total communicable diseases. I didn't name, it's not focused to one, it's related to TB, STD, or Hansen's, or any communicable disease. So in 2018, we saw I take that back, I corrected that one. We saw 3,653 clients. And then in 2023, we saw 1,253. And this is very, very important. If we don't learn how to control that if we don't have screening, and we don't have testing, we don't have the interventions, everyone could, it's like a COVID. If you don't take care of it, it will spread to the community, and it will be a bigger problem.
Ms. Gay, before you go further, so
Yeah.
the slide is incorrect, and you're saying, is that what you're saying?
Yeah, I corrected the
So instead
3,000.
of total communicable in 2018 as 1,000, it should read 3,653.
Yes, and then in 23, it's 1,253.
Okay,
Yeah.
thank you very much.
Yeah, sorry, I had to correct my typo. Okay, so our bureau at Central Public Health, we had space. As you can see in the pictures, we had space. We had a complete clinic with examination rooms. We had one bureau, one place. We had teaching areas, and we do educate nursing students from GCC, UOG, off-island, internship, master's prepared, and social services, social services students. We've been in a community of education. We have a waiting room and a medical records unit, and we were happy. We were happy to be there. We were happy to be together. Next slide. And then our bureau at Northern Community Health Center and at Hessler, we still do our job, and we manage our programs even through all this. But it has its challenges. Just imagine, I'm talking to a client, and my staff, my coworker, hears everything I say. And that's not right. That's not HIPAA. That is not patient care. But we are crowded in 2 rooms, in 2 buildings. We don't have a complete clinic. We are not centralized like we were. We have no space, no personal space for clients. And our bureau is in 2 places. Next slide. So I have some pictures. Oh, shoot. Oh, no. I have it on this one. Oh, shoot. So I have pictures of we have our client, our staff, 3 in one corner, stacked with other supplies around us. Just imagine. One 10 by 10 room with 2 staff in it because, our space is limited. Our medical records, as Linda said, is in boxes, in a shelf, and we're so happy that we can at least find them, but it is a challenge. We're not getting older, we're getting older, and our files are getting heavier. So we only have one examination room at Northern. Our one provider does it in the morning, women's health, and then we have our child health doctors who takes that same room. We share an immunization area. We share a waiting room with the other clinics. We even do our vital signs on the hallway because we have no room for our scales, or do our best, but we don't share information, of course, out loud, but until we see them in our private room. Next slide. We are a Bureau of Community Health and Nursing Services, but we are working out in the community, but we have no permanent place to manage our services. Yes, we're there, but half of our stuff are still in storage, so we do what we can. I still continue all my 7 programs and still get through accreditation, site visit, reports. We still go on with those, but we're still not happy. We need to keep, next slide. We need to keep Central Public Health Center for both our community and the people of Guam. Thank you for your attention, and if you have any questions, I am here. Thank you.
Thank you, Ms. Gay, and thank you for your work for all these years at the Department of Public Health and Social Services. Very grateful that you and your colleagues are brave enough to come and testify. So, Situs Masi. I have no questions. I think you did an excellent job. Senator Joe Brown, did you have any questions?
Thank you very much, Madam Speaker, and I certainly appreciate the testimony that you provided from the standpoint of those of you that are actually out there providing the services to our community. And I appreciate the information, the statistics you're providing, because I think this is really, as Senator Barnett had mentioned, as we have mentioned, the really important crux of the issue is being there to provide the services. You certainly have my support with this bill to maintain the ownership of this property under public health. And then I guess we'll wait what the information is as to the consideration of the building, what can be done. I mean, I am concerned that after 4 years, what may have deteriorated as a result, because if it's simply, close the doors and lock it up and leave it, anything that's left that's not maintained is going to have further issues. But I think both of you bringing your testimony forward has really made clear, at least to me, that we need to go back and provide that facility, be it this or a renovated one or a new one or whatever the case may be. It's unfortunate. I'm dumbfounded as to how this was allowed to stay. I think the first thing a responsible director would have done is to get the building assessed and determine how quickly can we get back to operations, especially if you actually did have a fire. If there was not a fire and we're dealing with, I'm not an electrician, but I know that, these electrical conduits and lines can be put in by a certified engineer that can go back in, electrical engineer that can go back in, reassess the building, determine what can or cannot be connected, and then we move on and we get back to the business of doing what we're supposed to do. But to simply leave the structure there and not address that, and now, as I think your information you're providing really is showing very clearly that there's a deficiency in the service being provided. And you're right, if these people had nowhere else to go or didn't know where to go, if they had to go run to different locations, they may just say, never mind, I'm not going to go and get the service. And definitely, as you mentioned, this is a population that probably needs the service the most. So thank you for taking, I don't have any questions. I think your presentations, both of you, made very clear to us what your position is from where you're sitting. So thank you for providing the information. Appreciate it. Thank you very much, Madam Speaker.
Thank you very much. I'm just noticing the data. So you gave us some data in the PowerPoint, but you also put it in your letter. This is even more you're talking now, you're comparing public health to the number of visits of patients compared to facilities like GRMC, and that, yeah, this is just shocking to me. The public health is carrying by far the bulk, maybe times 3 in the bulk of patients and patient care. Senator Barnett.
Thank you, Madam Chair. Mrs. Gay, thank you for, this is some great information. This kind of information you expect the director to come to the hearing with, quite frankly. Yeah, and for me, what is most alarming is we're talking about the infant mortality rate, and I'm looking here at your data on the 2018 Women's Health, 1,751 seen, 2023, that's down more than 50% to 947. Could you, for the viewing public, explain the impact of this and the results that we end up seeing out in the community when you guys don't get to see this very important group of individuals?
Okay, we usually see, so the pregnancy is their door in. So just finding out they're pregnant, that's a great accomplishment for them to get into our center. Knowing that there's a center there, and then at the same time, we're educating them from the day we see them about, you need to get a doctor, you need to start prenatal care. We educate as we see them. So we need to guide them, and with our prenatal care, we had a early prenatal class that they must see. They see our provider accordingly to the months they are at the time they come for the pregnancy test. So we're educating from then on about how you need to take care of yourself so you would have a healthy pregnancy. And it all starts, if they are able to take care of themselves, the baby will also be able to be normal. And with infant mortality, that's one of our biggest challenge, because we're seeing that they don't have the information on how to take care of themselves or how to take care of a baby, and what do they need to keep the baby healthy throughout the lifespan, especially the first year. And so we educate that, both the clinic, our nurses, educate the mom, and that's they need that awareness throughout within the clinic, within the community. And then we have home visiting that our nurses promote the safety of their pregnancy. They get them an appointment wherever they are. They help them to achieve the pregnancy, and then after, our home visiting would also see them so they can educate them more on child development and a healthy first year. Because once the baby is 1 year old and no problems, that means they should be living a healthier, childhood. But with our program, we hit the areas that need us most. We go to outreaches within the areas like Zero Down, Gilbaza, and a lot relate to Medicaid. Some of our mothers, even though they have Medicaid, they still need the education and the care to have because they did studies, I'm not sure if you know some of them, that there was a high percentage of Medicaid women who had an increase, were high in the infant mortality. So either they weren't following, when they get pregnant, they need to do this. They needed more education on, you have to go no matter how many babies you have. Every pregnancy is different, and every pregnancy is seen as your first pregnancy. So we try to educate in every way, and the awareness is important. So having us within the community and able to talk to us, call us, come by, we're there.
So ma'am, if a an expectant mother isn't able to avail of the prenatal care that you guys provide, what are some of the impacts of that?
Oh, that would be, GMH will get a big impact on complications during pregnancy, more lead to death. You know, if you don't, you never know. Pregnancy is always halfway. Your foot is halfway to heaven and halfway the other way. So you need to take care of yourselves, and we need to inform and educate that and provide services to prevent that from happening. But we provide a maternal child health program clinic, which we give free prenatal care, and with some labs and ultrasounds that are not are budgeted, but we do the care and the vitamins and any other care we can as our program avails to. Yes.
Thank you for that, ma'am.
Okay.
And I agree. In your slide, you said that you're still doing your job, but it's clear that the removal of the Central Public Health Facility has impacted the Department of Public Health's ability to deliver critical, in my opinion, life-saving prenatal care. And it's just across the board, right? I mean, the only thing that it looks like we're doing better is STD testing.
Yeah.
And this is what I said, when the real cost is paid by the people of Guam.
Yeah.
And I just encourage the director to listen to his employees, because I'm going to tell you, in healthcare, in any job, you want employees to be happy doing their job. Yeah, we can laugh about it, right? But you have to be happy to do your job. We have to create an environment where you're happy because the level of care that you're providing your patients is all there, not this haphazard Mansalapon, 17 different locations, $1 million in rent, and I mean, it's very simple, your objective and your mission, and no matter what name you want to give to these clinics in the community, what the services they're supposed to provide, it's a no-brainer, and our people, again, are getting the short end of the stick, and I'm very encouraged that you're providing this testimony, and I hope that it really reaches the ears that it needs to reach, ma'am. So thank you. Nothing further, Madam Chair.
Thank you, Senator Burnett. Senator Plas?
Thank you, Madam Speaker, and thank you for the testimony that you provided. Ms. Gay, what is your title at Public Health?
Administrator for the Bureau of Family Health and Nursing Services.
Okay, you had mentioned that you were there when it happened. What happened?
Well, we got called by our director at the time, Linda Denorsi, to come in because there's some damage or smoke coming out from the building, and we needed to open our doors, our clinic doors, to get the vaccines that may be, because once the power is out, that will affect the vaccines, and so we had to go there and open the door and remove the vaccine, and Annette Uggan was with me also. So as I take my the vaccines out from the clinic, and then also the main vaccines were there. So, but we saw the fire trucks, we saw the water on the floor, but we weren't able to see exactly what was happening in the other side. All they said is just get your vaccines and then secure them. While we were there, I just checked my side of the building, and I didn't smell any smoke, but we were just surprised of what was happening, because the fire was there and firemen were there, and we were just told.
Okay.
So, in the middle of the storm.
Okay, so in your position and at Public Health, is it safe to assume that you are part of what would be regular meetings or briefings as to what direction the agency is going to be going?
I wasn't in any meeting.
Okay, I'm trying to get to, so they asked you to move, and you moved. Was there any talk about moving back?
It was because whenever when you move someone or that much people, I wanted a plan. I wanted to see what was our plan before we moved, because you can't just move for just there's a fire or. I needed more, but we were not privileged to get any more information. But I was not happy, because we had a lot of things to move and no place to go. Just go to Northern, that's all they said to us. But we have more supplies, records. I know Northern, and it didn't have the space that we had.
Okay.
Yeah.
So, I appreciate your PowerPoint and your desire to want to move back. The question is, are you moving back? I mean, have they discussed it with you of any plans to move back? Has there been any discussion by anybody?
I know they said the assessment, we heard about that. That's all I know. That's all.
You can assess my car and say I need a new one, but that doesn't get me the new car.
No.
But, I'm looking at the bill, and first off, and I admit, okay, maybe we didn't cross our T's and dot our I's to ensure that this building and the lot of the building belongs to public health, and that's what we want to clean up. Or we want to make a statement and saying, you got to move back. And the question that I have, and the reason why I'm, as an administrator for a very complex and very necessary program within public health, I know that it's difficult to be able to manage your resources and manage your program in many different places as opposed to one central location. I'm not opposed to wanting to move back or to utilize the building again. I'm just wondering why we haven't done it. Okay? I'm just why we haven't done it. And I'm not going to sit here and point fingers, because I don't see anybody in here that's going to be able to say with all certainty, do it. It takes direction from somebody higher up than what's in here. When you look at at what you had presented with regard to patient encounters, immunizations, visits, when you talked about how you had to, for lack of a better term, MacGyver, okay, and do certain things so that you can not only provide the service, but you have to provide it in a safe, healthy, as well as legal means, and the challenges that are there. I'm going to say it. This administration has touted health care. And it's touted health care from as far back as 5 years ago. This government has had access to billions of dollars to fix health care. And it's now come to the point where employees who want to do a better job, who want to do the job that they know they need to do for the community, for directors and, and for everybody that's in this room that want to do better, to be handcuffed and to have to come here to ask to be able to move back. This is embarrassing for the administration. To have to put all of you in this position. I would hope that this bill had more teeth in it by saying, for God's sake, move back. You have the resources, more so than any other administration in any other decade. Okay. And so, if there's anything that I appreciated about this bill, is this conversation that we're having. Because had this been taken care of, when were you told to get out of the building? What year?
November 2020, 2019.
2019. It's 2024. Should have been done earlier. This shouldn't have been necessary. I feel sorry for all of you. And I'm not, again, to everybody that's in here, I know you've got all your, this is not laying blame on any one of you. I know you're doing your best with what you can. But when you're asked to do best with what you're going to be given, and let this falter like this, it should not have happened. So, I don't want, and I don't think anybody in here deserves any critical questions towards you. You're doing your jobs. Appreciate it. But maybe there's something you can do. Tell Adelup that what you had to experience down here was unnecessary. Had you put the priority that you promised this community that you were going to do. You have the resources. I want to take a little flexibility here, Madam Speaker, to say this is a continuation from the discussion that we had this morning. Don't tout that you're doing a lot of this stuff and you got better. From emergency management plan to emergency medical services. Lastly, I just want to share with you, totally unrelated to this, but I find it appalling that we have to do triage in the ambulance bay of GMH. We're doing what we need to do inside the hospital, outside the hospital. And we're having to have our patients, our people. First off, they can't find where you're at. They don't know how to access the services. It's too crowded. I hate to ask this, but how many lives did that cost? How many lives could we have saved? Thank you again, Mark. Thank you. Art, Pete, thank you guys. I know it's difficult. We've had our conversations. And I'm sorry that you had to be put in this position. It's totally unnecessary. Thank you, Madam Chair.
Thank you, Senator. I will go to Dr. Weir. Dr. Weir.
Thank you. My name is Dr. William Weir. I am retired from public health having worked there for over 20 years. And during that time, much of it, I was the acting medical director for the community health centers. I think that we need to understand the enormity of the health burden we have here on Guam. Over 50% of our population is below the 150% poverty level for the United States. That means half of our population. I don't know the current numbers, but when I was there, we had a population of about 16,000 people that were on MIP and 35,000 plus that were on Medicaid. MIP patients are required by the legislature to be seen at the community health centers. Medicaid patients can go wherever they can find care, but a few years ago when we looked into this, there were only 5 providers on Guam outside of the community health centers that were accepting Medicaid patients. All of our major clinics do not accept Medicaid patients. I did a staff analysis for physicians to cover this number of patients at one point and came up with about 33 physicians needed to cover this population. And at that point, we had 10 to 12. And that has not gotten any better since I left. We've all heard the testimony today. And I am here to oppose this bill. And the reason for my opposing the bill is twofold. One, I understand there's another bill before the legislature now to allow this building to go to Guam Community College to educate healthcare providers. And that Guam Community College has $300,000 to $400,000 that they're willing to spend to rehabilitate the building. I was still working for the community health center when the central facility was closed. And I had worked with Linda Pinco de Norci for 20 years and had a pretty good working relationship with her, I think. And I asked her, you know, why are we not reopening Central? It's pretty obvious that we need to have a facility there. Our immunization program basically crashed because they had no place to give shots. I mean, if you go down to their current facilities, they have big signs outside say, please don't ask us to give you a shot because we can't do it. It's not what the sign says literally, but that's what it means. We've already heard from the nursing portion that they're not able to work. The TB program hasn't come up here to sit down and tell you how well they're doing, but they've had to move most of their operation up to the north, and that's a long ways from people. Not nearly as convenient as their previous location. And they're understaffed to begin with, and TB on Guam is a big problem. We have, the highest TB incidence in the nation here. So we have a lot of problems. The second reason why I'm opposed to this is that public health has had this building for over 4 years now, and they haven't done anything with it. And my feeling is, when you have a big white elephant, and this is literally a big white elephant, and you have somebody that's willing to do something with it, maybe you ought to give serious consideration to letting those people do it. I think public health has had their chance. And, they have failed in a number of instances to deliver the kind of care that's needed. And to, put this in their hands, I think, is a big mistake. They've demonstrated their abilities, and I don't think we need to continue to push that. When I talked to Linda about the building, I was told that the building had considerable damage inside, and that there was an ongoing concern about the integrity of the roof, and that their cost analysis was that it was not worth putting any more money into it. That's all word of mouth, but I think that that's the basis for the discussion at the time, and the tragedy is that since that time we haven't come up with any alternatives. Most of what I know is through the newspapers, and I don't think I'm going to make any of you here very happy, because I have some pretty definite ideas about a new hospital and a new public health, and none of those center around Tamuning. I think that, and I haven't heard anybody discuss this, but I think that the legislature needs to kind of reassess their whole thinking process, because we haven't taken under any consideration what the effect of global warming is going to be on Guam. And I think it doesn't take a rocket scientist to realize that if sea levels rise 5 or 10 feet in the next few years, which is what's been projected, access to Tamuning is going to be severely limited from the south. There's some other reasons that Tamuning is not such a great place for a hospital as well. Anybody that's driven up there lately knows that traffic patterns are a big problem, but I think that we need to be looking seriously at a more central location. My feeling is that we're looking in all the wrong places. I would suggest that we look at Tijan. We have a bunch of ball fields there that are sitting empty. basically most of the time. I was told by the Chamorro Land Trust people and the other people that, these lands were given, to be used as athletic facilities. And, my suggestion to them was, why don't you take your Attica property and trade it for that? And everybody should be happy. The Attica property has some serious problems with infrastructure. Those are not a problem at Tejan. Tejan is centrally located, and it's not that impacted by access if roads are no longer there due to higher water levels. So it's something to think about. I'm happy to answer any questions anybody might have.
Thank you very much, Dr. Weir, and thank you for your many years of service to our community health centers, to the Department of Public Health, and really to the children of Guam, Sidus Masi, for all of that. And thank you for your testimony today. We have one more, Annette Uggan. All right, Doctor, do you have to leave right now? Is there any questions for Dr. Weir? Senator Barnett? Senator Blas? All right, thank you, Dr. Weir. Annette Uggan.
Hafidi, Madam Speaker, Senators, thank you for the invitation to come before you in my capacity as the Acting Chief Public Health Officer. I would also like to speak in the capacity of my real role as the Administrator for the Bureau of Communicable Disease Control, as well as a public health employee for the last 29 years, which has been for my entire career as a public servant. Margarita and the rest of my team, my coworkers within the Division of Public Health, have shared some information. I believe there will be other written testimony. And so I haven't prepared a written testimony. I don't want to repeat what has already been said or submitted, but I'd just like to kind of highlight within the Division of Public Health, the centralized services, and for me it's the then and the now, before the fire and after the fire. So back then, we were in our own building. We paid zero rent. Now, we have leased office spaces for Division of Public Health programs that were displaced, became homeless because of that 2019 electrical fire. And so now we have 6 programs or bureaus or sections now leasing in various locations throughout the island, Hagåtña, MANGILAO to Muning, and they are paying over $817,000 a year in rent. There are other offices, however, that have been co-located or placed within Northern Community Health Center, as Margarita had mentioned, within the immunization program that was already renting prior to the fire, such as my office, the Bureau of Communicable Disease Control Administration Unit, as well as our Ryan White HIV program, has a little cubicle space within the corner of the immunization program, as we are one team, and so we make do with what we have. Back then, we were one village, one building. All the direct services, as Margarita mentioned, clinical services from child health, well baby checkup, children with special healthcare needs. We had communicable diseases, TB, Hansen's disease, which is the leprosy program, STD, HIV, family planning and reproductive health, child and adult immunizations, women's health. We had prevention and control services for communicable diseases. Not only was there the clinical aspect, we had to do screening. We had directly observed therapy for our TB and Hansen's disease patient. We also did counseling, health education. Our chronic or non-communicable diseases, they also offered cancer screening, health education for like diabetes, obesity, tobacco cessation. We had our dental services. We had laboratory services. We had nutritional services. The WIC program had an office right outside our main facility so that they could cover the whole island. They offered breastfeeding support, general nutrition, And as I mentioned, the Women, Infant, and Children's Program. We had a central pharmacy that helped with the clinical services. We had a vital statistics record, and we had our X-ray unit. We had a lead line room with an actual X-ray machine. That was then. One village, one building. We are now in 4 villages, 6 buildings. And again, this is just for the Division of Public Health, who had central health services within the MANGILAO facility. So now if you want to go for the clinical services, as Margarita mentioned, you can go to Dedito Public Health. Her facility is 1 medical exam room, 1 converted waiting room when it's available to become an immunization room. The Tuberculosis Hansen's Disease Program, their DOT, which we had an isolation room within MANGILAO Public Health, a separate entrance, now they have to do it outside under a canopy. No isolation room. They are inside Dedito Public Health. Our clinical services, we do outreach. We partner with Total Guam. We partner with other community partners, being the private sector. We go out to shopping centers, mayor's office, villages, community centers, wherever we can find the space. Because again, as Margarita has already highlighted, our services have been greatly impacted. So again, we try to think out the box. Our team comes together. We try and co-sponsor events, or we jump onto other events that are being offered. However, those are limited. There's a lot of events happening in the Micronesian Mall Center Court. But if there are multiple providers, the immunization program and Margarita and her nurses cannot offer immunizations because of safety issues. It's too crowded, there's not enough space. HIPAA violation we have to worry about. So again, that's a lost opportunity. For prevention and control services, be it communicable disease or the chronic or non-communicable disease, you have Dedito Public Health, Hessler Place, you have Terlaje Professional Building in Hagåtña, you have Castle Mall Building in MANGILAO, and again, public areas. As our displaced Ryan White employee, who used to have 2 offices in MANGILAO Public Health, as I mentioned, has a little cubicle in MANGILAO at the Castle Mall Building. She used to have a space in Dedito Public Health, but due to competing priorities and not enough space, we are impacting community health centers, as we spoke 3 weeks ago at the oversight hearing. So she's had to think outside the box and has gone to restaurants. The parking garage at MANGILAO, the Castle Mall Building, has a covered parking garage. She will meet clients outside. Again, we will do what we need to do for our clients, making do with what we have because we do not have the 1 building. Our laboratory services have also been moved. We know we are renting at Rancare Building, $25,000 a month. But direct lab services to our clients is at Dedito Public Health, or you have to refer to go out to contracted services. For your nutritional services, we now lost the MANGILAO site. Clients will need to go to Tizan, Santa Rita, at their satellite office. They have Southern, and then again in Dedito Public Health. For vital statistics, they are in Rancare Building in Tumaning. They are also paying rent, approximately $9,000 a month. For our dental services, we have none besides a limited dental varnishing, thanks to the training Margarita and her nurses have done, nurses doing dental varnishing. We do not have a dentist. They retired, we don't have a dental clinic. Or they avail of, again, partnering with internal or external health partners to do outreach events, and they will conduct varnishing at those events. Our X-ray services, in-house has paused. Our X-ray machine is in a crate, brand new machine. Our lead line room is sitting in MANGILAO Public Health. So currently we have to refer out TB patients, suspected TB patients, out to receive contracted services for X-ray. I do believe in partnership with GCC. For years we have tried to have Guam Community College medical assistant students. They come in, they do hands-on with us. We actually even did a paid MOA with them where they could have hands-on skills within our department. So by all means, we do need to expand healthcare capacity on Guam. We have tried several years ago with our colleague Barbara Muffness, an RN, who was heading the GCC medical assistant program in their allied health department, to have a bill passed to recognize medical assistant position within the government of Guam to help augment our nursing team, which again, is national shortage for years. So again, yes, we are all about collaborating and partnership. However, I would have to advocate, again, as I did 3 weeks ago in front of the esteemed panel here, to return our home. One village, one facility for the Division of Public Health, my team, other services, but more importantly for the people of Guam who need just one location to be able to walk down the hall, get your child's birth certificate, go enroll, and see the WIC program for breastfeeding and nutrition services, sign up for the WIC benefits, come down the hall again for immunization and for well baby checkups. There's blood work that needs to be done for WIC or for their child with special health care needs, go further down the hall to lab. Guess what? It's time for a dental checkup. Right across from lab was the dental program. So again, I implore this body, and I actually invite all of the members of this committee and all senators of this 37th legislature, come and do a walkthrough. Come and visit the facilities so that you can truly understand the situation of the past 4 years. Thank you.
Thank you again, Ms. Huggen. Could you state your position again for the record?
My real job is the administrator for the Bureau of Communicable Disease Control within the Division of Public Health. I am currently the acting Chief Public Health Officer for the division.
All right, thank you. I'm very appreciative of you who are currently employed by Department of Public Health, and I want to thank the director for allowing them to testify and not intimidating them or giving repercussions. So we've seen this in other agencies, so I'm very grateful that they felt free enough to come down here and testify. We actually have a list of people in support of the bill who signed up, who didn't want to testify, but also signed up in support, including Chima Mbakwin. Thank you for being here. Vanessa Ampinko, is that wrong? And Annabelle Estrada. They indicate they're all employed at Public Health. Jonathan Lujan. And one of these is a veteran, Johnny Atulay Taitano. But again, I think that takes great courage, and more importantly, it looks to me like huge dedication to your patients. So I thank you for making them the priority. And this bill was not intended to pit anyone against anyone. We need all of these things together. But it's really just because of the concerns that you've raised to me, a matter of what is most urgent and can we wait. Even if we are going to build a medical complex with a brand new public health and all of these facilities in there, can we wait for that? If this building is available and our equipment is in boxes, including x-ray machines, dental facilities, all your gear, all of it, should that wait while we see declining number of people being served? That's really the bottom line. For me, not trying to pit anyone against anyone, I just think if these people, we want to protect them from death, we want to protect them from illness that we hopefully can stop or prevent, then we need to get them into these clinics as fast as possible, and we are trying our best in all these other facilities, and you have really tried very hard, but it sounds very clear to me, and I'm very sad about Dr. Weir's testimony, saying we shouldn't give it back to public health because they've had it and they haven't done anything with it. I mean, that's true, but it's sad. It's a very sad state of things on Guam, if that's how we act for real. But I think you made a good point. But thank you. I'm very grateful. And I know many of your colleagues are here. Thank you to all of you. All right, Senator Taitukui.
Thank you. Just really short, Madam Speaker, and thank you for the opportunity. And you know, you're the true heroes here today, actually, coming up and testifying. And I'd like to thank you to Art for allowing those employees in your agency to come and testify without any harassment. But you know, my door is always open. If you do get harassed, come see me, okay? Tell it to Tello. I don't hold back, you know. So, but again, you are the true heroes, and I thank you for your long service and dedication to public health. I know you want the best for the people of Guam at your agency, so thank you.
Wait, Senator, I'm sorry. Is there still a Floressa Santos here? I'm so sorry. I didn't read the message correctly. If you're welcome to testify, please join us. My apologies.
Okay. Hello, Honorable Speaker and Senators today. My name is Floressa Santos. I'm from the village of Santa Rita and Agana Heights, so from the south and from the central. And I can proudly say that I love Guam and our people, and that our people are working hard and striving for a better life. And in order for them to succeed, they need structure and maintenance. By providing opportunities and taking care of their health, they are better able to take care of others. And so what I think is imperative that MANGILAO be allocated back to Guam Public Health. MANGILAO serviced not only the population of Central Region, but to the whole island. It provided services, information pertaining to vital statistics, health certifications, food stamps, Medicaid, women, infant, and children. And it was a collection of services with parking in a visible and accessible location. I myself utilized the facility and have many family and friends who grew up utilizing dental, medical, and immunization in MANGILAO. And growing up in southern and central parts of Guam, we weren't as fortunate enough to find a ride further than Tumuning or even past Umatat. Most of the time, we walk to the closest store, 20 to 30 minutes to pick up just medications, and dental was about 25-minute walk. We want to imagine living in a region where do we go coming from Agana Heights? How far is it to walk to a Guam transit station to get to either Dedido or Inaraha nowadays? But now that Medicaid has moved to Tumuning Ran Care, the child block grant, which provides free daycare, it's rented out all the way in MANGILAO, as well as Medicaid and prior authorization, senior citizens division, and immunization. So many people still do not know where to find it, and they just don't have the means to get there, or they don't know it exists. So the main public health central region had accessible rooms, designated offices that the island could make use of all in one location. They had medical, labs, procedure rooms, WIC, dental, as our speakers that have said before. But I do ask, you senators or everyone to learn from our history, our people, and to think about our future of our children. And the Central Region facility was successful and functional. It will not only service the Central Region, but it also will include Agana Heights, Tumuning, PD, MANGILAO, Barragata, Sinahanya, MTM, Chalampago, Ordot. And we just don't want to forget about our brothers and sisters from the outer islands as well that to come in. We want to think about the future of our whole island. And when we develop Central Region, we'll be able to bring back district nursing, continue servicing the people by visiting those that may not be able to get to that clinic. But by providing the lot back to public health, we'll be able to huddle those multiple agencies, resources, cultures, and the languages in a central location. So it yields much opportunity to develop in healthcare and in health and partner with the schools such as UOG and GCC. And by doing that, so we also do more outreaches in the village and areas that are less likely to know about the services. So we ask that we please open the doors of Central Region to public health so that we can reach more lives and provide public servicings to those who are in need.
Sizus Masi, Floressa Santos. Thank you. Senator Brown.
Thank you very much again, Madam Speaker, and certainly thank you to all of you that have come to testify. I know we're thanking the director for allowing you to come and speak, but you should have that ability to do so without fear, because you guys are the ones that actually do the work. I always look at areas where we're serving the public, where the government has more direct engagement with the public is an area we should always make an extra effort, because, you know, it could be registering your car, whatever the case may be, where we have to, you know, or standing in line to pay your taxes. We should make it easier for our people to access those services and prioritize that. And I think in this particular case, I think the response to the situation, I think now looking at it's not acceptable. And I've run agencies, others here have also. You know, I understand COVID may have been a factor, but I don't know if my main office was not functional. I'd want to make sure I did something to get it back and operational so that everything else can be provided, because COVID in and of itself isn't the only issue of public health care that we need to address. So, I mean, you certainly have my support. I will support this bill to make sure that the property goes to public health for the purposes that is intended. And I agree, you know, Madam Speaker, Dr. Ware's comments. I don't know if there's an illusion in government that we're going to be tearing down buildings. You know, it's like you pay your mortgage after 30 years, then the next thing you're going to do is you're going to tear the building down. If it's structurally sound and can still be repaired to facilitate a sooner or quicker use of the building, then by all means, that's what should have been done. An assessment should have been done. You know, getting a master electrician to go in there and assess what's useful, what isn't, what needs to be disconnected, what can still be made functional. Those are the kind of decisions that should have been made, particularly if you didn't have a physical fire that actually burned down walls and damaged infrastructure there. But to simply close the doors and leave it to deteriorate, and now here we are, you know, as expected, but certainly by the information provided, seeing that less people in our community are getting serviced by public health is very concerning. It's like you fail in your mission. And I'm sure for those of you that choose to do this as your life career is to be commended, because you can go do it somewhere else and make more, right? You can go maybe have an easier work environment if you weren't working for public health. So the fact that you're there and you're willing to and you want to provide the services, really, I think it's important to recognize that. And we should by all means do whatever we can to facilitate giving you a building that you can provide those services in. A lot of people want to run away from work. They don't want to do it. They just pick their paycheck up let's not kid ourselves. I've been in GovGuam many years, going on 35 now. Hopefully I don't look that old. I'm 36. But that's the reality. But for those of you that really want to get out there and help and service our people, yes, you should be recognized. And I appreciate you coming forward. I hope as a result of you speaking, because I think your voices are very important, you know, that we need to work towards that. That needs to be a priority. And I'm saddened that this got all, you know, mixed up with the politics, you know, the politics, because there's no doubt in my mind if there wasn't an agenda to build a complex and facilitate and everything around it, that something would have been done, something should have been done sooner. If anyone had any sense in running that department, they should have reacted. If your building got burned down, I understand. I was in a building where, you know, like I said, the walls were charred. There wasn't much of anything left of customs or our HR division, and we had to essentially tear it down and rebuild it. But we got back in the building and we were operational. There's no reason that this couldn't have happened for public health either, especially if it wasn't a structural issue. So, Madam Chair, thank you, and thank you to all of you for taking the time, and I know it took a few hours today, but coming in and letting us know and letting the public know what your concerns are and what the unfortunate result has been of not having a centralized facility to operate out of. Thank you so much. Thank you, Madam Speaker.
Thank you, Senator. And my apologies again. There's someone else who wants to testify who's been here and waiting very patiently. So if I could call Ms. Relida Sumailo.
Hi. My name is Rita Samailo. I'm a community health nurse supervisor with the Division of Public Health, Bureau of Family Health and Nursing Services. I have worked for the Department of Public Health for the past 11 years. Because of the catastrophe, the event on late 2019, Public Health Manila was deemed unsafe. In 2020, BFHNS relocated into places like what Margarita said. Northern Public Health housed 15 staff in a workplace that's approximately 20 by 37 feet, which is once used by 6 staff. And the other 4 staff members were housed at Hessler, At Northern Public Health, once you enter the room, you are immersed with cubicles, desks, and boxes. There are 4 cubicles approximately 4 by 4 feet. One cubicle has 3 nurses using it as their workspace, and the other 3 cubicles have 1 nurse each utilizing it as their workspace, at the same time a storage area. The Administrator of PFHNS is situated in a private room with multiple boxes that contain essential information for grants and staff. The other office areas are workspace for other staff and storage for medical or office supplies. We were given 1 room in Northern Public Health for our provider to see our patients. You can see the decline on how much patients we have seen. At Hessler, the Bureau was given 2 rooms, 9 by 4 feet, with each of the 4 staff members. Each room is workspace for 2 employees and a space to store their belongings in a box. Some of us have not unboxed those boxes. Okay. After 4 years of working in an environment where supplies and belongings are boxed and not neatly placed on shelves or tables, with portable tables as our workplace, inadequate lighting, an uncomfortable work environment, morale starts to decline. But even though our spirits are sometimes low because of the working environment, we continue to serve Guam the best we can. The upper management had many decisions about finding a single space to make it more convenient for the residents who drive to multiple locations for services. It has been 4 years since the fire. We have not yet moved back to Manila Public Health or find a place to service the same number or more than what we used to serve in Manila Public Health. Returning a place where you serve more people would be nice, since we always say we service the most vulnerable group, right? Everyone has talks about healthcare and how important it is to the island, because people do not realize the importance of Manila Public Health Community Health Center. It is the only clinic addressing the disparities of uninsured, equitable access to health resources. It's the only clinic that administers immunization non-insured and underinsured population. It's the only clinic that does dental work, cares for orthopedic and hemophilia patients regardless of insurance, provides uninsured pregnant women's access to prenatal or postpartum health care, administers child checkup for uninsured children, and most importantly, to be seen, to be heard. Please give us back Manila Public Health and help us fix it until a new medical complex and a building for Manila Public Health is completed. I do not know when that medical complex will be built, but we can go back and start preventive care so the hospital will not be inundated with sick people. Thank you for the opportunity.
Thank you very much, Ms. Samilo. Thank you. All right, Senators, any questions? Okay, Senator Barnett.
Thank you, Madam Chair. I just want to again commend the panel for their testimony. I'm just encouraged. I'm encouraged. You know, like Senator Brown had mentioned, a lot of times the politics muddies the water, but to hear your testimony and your voices ring true with the passion and the conviction that you have to serve our most vulnerable and our most needy in this community, you're making me feel good. I mean, I don't necessarily like what I'm hearing, but it's making me feel good that you guys have the patient care. That's right in your heart. And Annette, I mean, I was texting a friend of mine that said, oh, Annette Uggan's really smart, and I thank you for your testimony. I know that we got really close in the pandemic. I think I interviewed you a few times a week, every week for the duration of the pandemic, and I never got the feeling that you were overwhelmed, even though it was the most overwhelming time that I think we've seen in our lives. And so I thank you again for your testimony on the record, yours as well, ma'am, and thank you for coming out. And I just hope that the director is able to hear the words that you guys are speaking today and support the effort that will not just restore the services that are severely lacking in our community, but also the effort to boost the employees' morale and give you guys the tools that you need to do the job. Thank you so much, Madam Chair, and thank you again for your testimony.
Thank you, Senator. Senator Blas. All right, thank you. So those who have not testified, the committee will continue to accept written testimony on the bill until January 16, 2024. Testimony can be emailed to I'm going to take that back. There being no further testimony, this hearing will conclude. The public hearing is now adjourned, and it is for 5:20 p.m. Situs Masi, thank you for spending all your time and for your testimony. Thank you.